No.
There's certain conditions where the blood very thin and puts you at risk for bleeding.
No, it's on this one. It's on this one. This is the link I set up to send out and post to a story. That's why I went and grabbed this phone. Say hello to the world.
Is this YouTube?
Yes.
I thought it didn't work.
No, I had to go grab the work phone so that I could post the story to your Instagram page, and then I wanted to post the link to the YouTube live on the Instagram story. OMG, aloha, hi.
So what we can do.
Are you on Instagram live? Oh, interesting. Okay. Everyone says hello.
So yeah, we're making a woman go back in time today, probably 30 years. It'd be awesome. It's gonna look stunning. I've already done the brow lift and fat transfer. I'm working on the upper blepharoplasty right now. I'll take this in. Stand up.
People are asking what the pain in her mouth is.
Oh, that's called an oral airway. So we don't need to intubate the patient. It basically keeps the tongue forward so she doesn't obstruct. And then the little tube, no, I'm going to go through here. The little tubes are oxygen. On a CO2 monitor. All these tiny little things that need to be done.
Blessings from Canada.
Canada. You should come and see me. It's been a while since I've had a Canadian.
Thanks for the love. Hello from Texas. Ouch.
I don't feel a thing.
Dr. Truesdale, your working is the best in the world.
Thank you.
People on YouTube, that's what you said when you first started about the
So today we're doing a brow lift, an upper blepharoplasty, lower blepharoplasty, skin pinch, fat transfer, lip lift, lateral canthal suspension, face and neck lift, CO2 laser. She's going to look about 25 years younger. see how the incision just zips right up with the zipper?
Okay. Hello from Long Island. Eileen also from Central Florida. Hi, Dr. Truesdale. Saving my money. I'm from Texas. You are amazing.
Thank you.
Cynthia, you're amazing too.
Cynthia's my right hand. Can't do it without her. Not as easy.
Exactly. What they told me.
So, is there somewhere that I'm going to be able to put this so that it can stream while I go set up?
Really, what time is the photo shoot?
The photo shoot starts at 1. We are doing a testimonial video with the patient beforehand. Yes, I need to grab this stuff, but that's I think there was a little bit of a last minute change. I need to figure out what is going on with it. So I think they want. I think there might be a potential to take a field trip to your home.
Someone's asking, why do you use the Q-tip in this area?
It's very atraumatic, meaning it doesn't cause a lot of inflammation, it dries things up, and it's very precise. It allows us to see exactly where we want to dry the area without using a big gauze, because this area is so small, it would block our vision. Let's take a micro pickup.
Someone asked, what procedure is this right now?
Right now we're doing upper blepharoplasty, but today we're doing a brow lift, upper bleph, lower bleph, skin pinch, lateral canthal suspension, fat transfer to hands and face, base and neck lift, lip lift, CO2 goes in. Just getting the works.
So she's getting a combo of an upper, left, and eyebrow lift.
And more.
And more.
Someone's asking, did you also do something to the hairline, why you're just incision there?
Yes, I did. Part of the brow lift, so she has a very high forehead. And so typically I like to hide the brow lift incision back in the hairs. But if I would have done that for her, it would have pushed her hairline back too much and would have made the job of getting over her scalp down to her brow very difficult. So in her case, I put the incision just at the hairline. time.
Someone was also asking, can you do a laser with all this?
I will do a laser. That'll be the last thing I do.
What does a laser do?
So all the little brown spots on her skin will be minimized or gone. Her skin texture will be tighter. The pores will be smaller, and the fine lines will be as close to erased as humanly possible. We're gonna do the lip lift next. Come back for a little
Eyelids.
She has bags and excessive skin, and her above her eyelid is super. Her brows are fallen and really droopy, extra skin in the upper eyelid. She used to. Anymore. Good, that's an upper blepharoplasty. Now we're gonna do a lip lift. Upper bleph is done. It's already looking more useful and prettier. Awesome.
What would be a marker with a 16?
Yeah. 4x4.
We're just removing the skin, Dale.
You'll see in like 5 minutes. Makes the look prettier, more shapely, more youthful, and it adds sexiness. I'll show you. This surgery is one where you can see the effect immediately. And in her case, it's going to be super powerful. It'll be really pretty, like gorgeous. Okay, so if you look here, let me get irrigation first. So if you look, this is how long her lip is, and you can see how thin the lip is. Now, after I do this stitch, you'll be able to see the magic of this surgery. So this is what her lip looks like now. And then when I tighten this, see how much prettier that lip has become by accentuating the Cupid's bow.
Can anyone get this done?
No, you have to be the right candidate. Your face has to work for this. A lot of people are candidates, but sometimes I deny people because it just won't look right. So good. She's becoming brand new. You guys are watching magic happen.
Do you have to be put asleep to get this done?
No, you can actually be awake for this. I just use lidocaine like going to the dentist.
Is the post-op painful?
No, people almost have no pain. Mildly swollen, feels a little tight for the first few weeks, but honestly, it's just like super easy surgery. Not easy to do, but not easy to do well. It's easy for me to do, but it's not. You can get this wrong, and then it's devastating. The surgeon doesn't do this the right way because it's permanent. If it doesn't heal well, the scar is awful. So you really want to make sure the person has a lot of experience doing these. But you can't put the skin back.
Do you do facial feminization surgery?
Yeah. I can do anything to the face. And in reality, this is one of the top facial feminization type procedures. What we've done so far has already made her look more feminine and pretty and young. So there's a lot of crossovers, just different applications. You can see how pretty her lip looks now, much prettier. And this is just the beginning. Qué bonita.
What other procedures might be involved in facial feminization?
Hairline lowering, brow reduction, upper blepharoplasty, rhinoplasty, chin implant, V-line surgery, fat transfer. Pretty much any aspect of what I do can be used to masculinize or feminize the face. It's just you have to understand the facial anatomy to do it.
Would you recommend this over fat grafting into the lips?
It's a different look completely. Fat grafting is for the pink lip, so they accomplish different things, but I don't like fat grafting to the lip. I still prefer filler in the lip. Now I do fat graft the white lip, which is the area just above the pink lip. So if people have like smoker lines or volume loss, crazy skin there, that's actually a very nice pocket technique for those people. But I don't like the risk of lumps or bumps in the lip that can happen with fat transfer. So I still put filler in my lip. Perfect. So now I'm going to do the top layer of sutures. And these sutures that I use are thinner than human hair, so they leave almost no visible scar. You can see how meticulously they're done. Oh, we're also doing earlobe reduction. Forgot about that. So how many procedures is this, Rachel?
11.
11?
11.
Wow.
11 individual surgeries for this lady.
Wow.
To bring forth the beauty that's hidden underneath the skin.
Is that typical for people to get 11?
No, everybody's different. I mean, she needs a little bit more, and she also is allowing me to do all the stuff that I want. Most people, it's about 5 procedures for facial rejuvenation. Usually face and neck lift, fat transfer, something with the eyelids, and sometimes brow. She's getting the extra with the lip lift, and the earlobe, and the laser, and the lateral canthal suspension.
Out of the procedures you've already done on her, which is your favorite?
It's hard. It depends on the face. In some faces, the lip lift is going to make a huge difference. In some faces, the brow lift is just stunning. Some people, it's the upper left. Some people, it's the fat transfer. My favorite is whatever makes the most beauty. Whatever I gotta do to make it awesome. But my favorite surgery is the face and neck lift, which we'll get to in about an hour. So far, just for you guys, we've done fat transfer to face, fat transfer to hands, brow lift, endoscopic brow lift, upper blepharoplasty, and we're finishing up the lip lift.
How much skin did you remove from the lip lift?
It was 5.5 millimeters.
What's the most amount of procedures you've done on one person?
Probably like 15 on one person. 15 different individual little surgeries. This lady's close.
Someone said, did you say fat transfer to hands too?
Yeah, I did. hands look younger by camouflaging the deflated skin and camouflaging the veins and tendons. The hands just look plump.
Where else can you add fat? It's not the face.
The temple, the supraorbital brow, the forehead, the chin, cheeks, the under eye, the orbit, rejuvenation sulcus, nasolabial fold, the earlobes, under the skin, the upper lip, the lower lip, pretty much everywhere. One place I don't like injecting fat is the pink lip, but or the nose, but everywhere else is kind of game. Perfect. One more suture here, and then we're done with the lip lift. And then I'm going to take a look at her lower eyelids, make a decision. So I'll have to let you guys go because I have to pull up her photo so I can make a decision about how I want to approach her lower eyelid, and we'll rejoin back with you guys later. Thanks for checking me out. Actually, let me go over there.
Let me show them really quick. Before we go, when you step out, can we have you show every aspect of the face? Okay.
And Rachel already got a bunch of contacts.
Oh, perfect.
Interview with us this morning.
Yes.
All right. We'll go down and dry.
Do you want me to zoom out a little bit on this one? A little bit? Like, other way? Yeah.
All right. So Q-tip. So far, I've added fat to her temple, her under eye, her cheek, her fold, a little bit of this white upper lip, this pre-gel sulcus, the jawline. I have also added fat to her hands. I've done a brow lift, so you can see now the brow doesn't fall, and it's in a nice pretty position. I've done the upper blepharoplasty and then the lip lift. Next, I'm about to take care of these bags in the under eye, tighten up the lower eyelid skin and the lower lid itself. Then do the face and neck lift, the earlobe reduction, and then the laser. Awesome. Nice and local.
Thank you.
Yep, thank you.